Hi guys, welcome back to another episode of Spill the Beans right now. My name is Rakhi Krishna. I am a pharmacist by training. I'm working in the pharma industry here in the UK. Today I'm going to be covering all the requirements and the steps involved in getting registered as a pharmacist in Canada. Yes, that's right. So I'm going to be joined by Amalindu Suresh, who is a very close friend, and she has right now completed the most important and the challenging step in the whole registration process, and she's just teeny tiny step away from getting that registration and licensing. So in this conversation, we are going to be covering the most important steps, how long it's going to take, and what's the money involved in this. We also cover if it is important for a pharmacy technician to getting registered as a pharmacist, and also most important question, what is the scope of a registered pharmacist in Canada? Stay till the end of this video because Amalindu is also going to share the name of the course which she believes was the main catalyst of her successfully completing the exam. So let's get right into it. First question I want to ask you, Amalindu, is that could you provide a detailed overview of all the steps that are involved in getting registered as a pharmacist in Canada, including the requirements, the visa application if necessary, the centers, internship requirements, and all of those?
Yeah. So visa requirements, I don't have a lot of idea about it because I came here after I got married. So I basically came here with a spouse PR. As soon as I came here, I applied for my document evaluation with PEBC, aspiring to do the licensing with the Canadian licensure. What you have to do is first you have to create a PEBC account, and then you have to create an APRA account. So PEBC is the examining board for your licensing, and NAPRA is like the regulatory board who gives you your license. So you have to create both accounts, and that will give you a PEBC ID, which is your roll number for the whole process. And then once you create an account with NAPRA, you'll get an NAPRA ID too. So you'll get two IDs. And after that, you're actually eligible to apply for document evaluation. So you can go to your PEBC account and then you apply for document evaluation. I think it's about 700 Canadian dollars now, which is close to 43,000 Indian rupees. So once you apply for document evaluation, they will send you an evaluating paper with a few information that you have to fill, and you have to post a photo, and then you have to include all the necessary certificate. They'll give you a checklist. So you have to collect all your certificates, and then you have to send it to PEBC, and then they will evaluate it. And if all the requirements are met, they will let you know. It usually takes about 4 to 6 weeks for PEBC to give you the reply email. But for me, in my case, I did this during the COVID time, so it took me long to get my document evaluation done. So once you finish the document evaluation, the next step is evaluating exam. So as soon as you get the approval for your documents from PEBC, you are eligible to apply for the coming evaluating exams. They usually conduct 2 evaluating exams every year, 6 months apart. So if you're ready, you can apply for the upcoming one, or else if you want to take more time, you can do that too. But once your document is approved by PEBC, it's only valid for the next 5 years. So you have to make sure that you finish all your exams within that period of 5 years. And the evaluating exam will cost you about 900 Canadian dollars, which is about 55,000 Indian rupees. It's multiple choice question. You can write it from your home. You don't have to be in Canada. You can even write it from any other country. Once you finish your evaluating exam, it will take about a month for your results to come out. And then if you pass the evaluating exam, you're now eligible to do the qualifying exam. The qualifying has 2 parts, MCQ and OSCE. The MCQ part of qualifying is considered to be the toughest of the whole process. So that exam is also multiple choice questions, but the type and it's basically more clinically oriented questions rather than what you had for your evaluating. So the MCQ will cost you about $845, which is 52,000 Indian rupees. You can split the MCQ and OSCE, and you can do it separate. So let's say if you're writing evaluating exam in June, after 6 months, and you pass, and after 6 months, you can write the part 1 of the qualifying, which is the MCQ. And then after 6 months, you can do part 2, which is the OSCE. A lot of international students prefer it this way because taking MCQ and OSCE together can be a bit stressful because they both have different types. They both need different types of preparations.
Mhm.
So in my case, that's what I did. So I split the qualifying. I did MCQ and then OSCE.
Okay.
So OSCE is going to cost you, OSCE is the most expensive of all. It will cost you about $1,17,000.
Okay.
$1,17,000. So that is the, so once you finish OSCE, the major part of your exams are over. And then based on which province you are in, your processes and the next step can be different, like it will vary, because some of the provinces you have to go through a bridging program. Some provinces, they don't ask for the bridging program.
Mhm.
It all based on where you're coming or where you're staying.
Okay.
The internship hours also differ from province to provinces.
Mhm.
Usually the minimum would be about the most, the minimum number of days that you have to do an internship would be about 3 months, I would say, an average.
Mhm.
But like I said, it can differ from province to provinces. And then you have to write, if you come here with a spouse PR like me, or if you haven't written the English proficiency test like the IELTS, you have to do that before applying for the license. And also the final step would be a jurisprudence exam, which is the law exam.
Yeah.
It's not a big deal. If you pass all the other three, then it's not a big deal at all. So by that, the whole exams are over.
Mhm.
Then you just have to wait for the authorities to give you the license. That's it. You can also go to PEBC.ca website. It's pretty clear and it's very straightforward. They have it as a flow chart, so it's easy to follow. And it's not very confusing. So in my case, I just went to the website and it was all straight up there.
So if I may ask, at what step are you currently in, and by when do you plan to complete all the steps and become registered?
I finished all my exams. So now I'm planning to take a break in between because I'm planning to go to India.
Yes.
And once I come back, I have to start my internship. And then after that, I have to give the jurisprudence exam. And hopefully, yeah, that's it. I would say if you pass all the exams in first attempt, and like if you're doing the qualifying like as two different exams, you're not doing it all together, it will take you about 2 years minimum.
Okay.
Because they only have exams every 6 months. So technically, even if you pass the first time, it will take that long. For me, it took longer because my document evaluation was delayed, and I didn't attempt the first evaluating exam. I think I took the second one.
Okay.
So yeah, so it took me long. It took me about 2.5 years.
Okay.
Because the delay that I had was not from the Canadian regulatory authorities, because I have to get my transcript from my university, and I did my Pharm D from Coimbatore, so I was under the MDR Medical University. They were closed because of flood and also because of COVID. So that was the reason why it got delayed.
So it was from the whole country that we had problems.
Yes,
from the
but I know a lot of people, I know a lot of friends who did their document evaluation very recently, and they all got it done in like 4-5 weeks.
Okay, cool. So is it possible for international pharmacy graduates to come to Canada and start working in a pharmacy before completing their registration?
Yeah, so if you have a pharmacy degree, you are actually eligible to, if you want to work in a pharmacy, you can work as a pharmacy assistant, because there is no, like, they don't ask for any subject-oriented eligibilities when it comes to that. You just need a background in science, that's it.
I see.
But then it all depends upon which province you are in. Because some provinces, they do have a lot of competitors, so it will be hard for you to get into a pharmacy.
Okay.
So it all based on what time are you coming and which province are you coming. But otherwise, it should be fine. They don't ask for any, you don't have to have any sort of license to work as a pharmacy assistant. So in my case, that's what I did. I came here, I started working as a pharmacy assistant while I did my licensing, all the paperworks. And then while I did my exams also, I was still working. I usually take a month off before my exam and I study, and then I do the exam, I join back, and then again I work, and then I take another month. That's what I did. I would say it's a good idea to do that because you get a lot of knowledge working in a pharmacy. You get to know about the Canadian system.
Yes.
So I would always suggest the candidates who are going to write the exam to just at least go volunteer in a pharmacy and see how things are getting done.
So just a question, like we were having this discussion previously. So is it important to become registered in Canada? Can't a
It is
person continue as a
it
farm?
is very important.
Okay.
I would say uh, because if you have an option, then why shouldn't we take it? Because it's all worth it at the end. So it's hard, it's really stressful, it's time consuming, it's expensive. But if you have all the materials and if you have everything, then I would say just go for it, because once you get licensed, your scope increases, your pay increases. That's the most important thing. You can getting licensed is like very important.
I see. Yeah.
Like your entire lifestyle shifts,
Mhm.
So yeah, I would say if you are okay, if you have all the other tools to go into the procedure, then you should do it. At least try once.
I understand that you didn't do a course before getting into this whole licensing step, but from your experience, from what you're seeing in your setup, in your environment, how can a international pharmacy graduate who comes to Canada, what kind of courses or short courses, like a 1-year course, they can choose to enter the country and then start preparing for the registration process? So do you know about any of those short-term courses or like the 1-year courses?
So for anyone who is coming as a student or who wants to come as a student, there are a lot of diploma courses that's available.
Mhm.
I would suggest taking something related to pharmacy or anything with the science background, and then work for, so that the diploma course won't be longer than 2 years.
Okay.
So if you get, so you still have the touch in the subject, you're still not losing the touch. If you take like something pharmacy related, I don't have a lot of idea about the courses out there, but I'm pretty sure there should be a lots
Mhm.
of like pharmacy related courses.
Mhm.
So they can take any of those courses, and then once they finish, they try to find a job which is related to that course,
Mhm.
and then start your procedure, because the whole process is going to take a lot of money. So you have to make sure that you're financially secure to, you have to spend time. Like you have to at least like stop doing work for at least a month. So you have to like finance yourself. So you have to be in a very safe place to go ahead and do the exam. But there is no rush, there is no age limit. You can do the exam whenever you want. So I would say make yourself settled and then go try for the exam. So
Okay.
anyone who is coming as a student, yeah, take a course which can still provide you
Mhm.
with enough money and time so that you can invest that into your process.
Okay, makes sense. Next question. What is your experience as a overseas qualified pharmacist working in Canada in terms of your work-life balance, the working conditions, the opportunities?
I'm not licensed yet. So I'm still working. I was working as an assistant, and now I'm an intern. Um, there is not much difference between overseas pharmacist or like the Canadian graduates. As long as you're licensed, you're a pharmacist. That's it. So in terms of the workplace and the work environment, it's really good. It's very secure. It's very stress-free. Based on, if you're working in a hospital, it can be stressful, but retail pharmacy, it's stress-free, it's hassle-free, compared to other jobs.
Mhm.
No, I don't mean that it's like chill, you can just sit and chill, but you have to do your job, but at the same time, it's not like, it won't get into your head.
Yeah.
So the scope is incredible.
Mhm.
You're not, you get like, if you lose this, you'll have tons of other opportunities. If you don't want to work as a retail pharmacist or like a clinical pharmacist, there are other opportunities that are available for you. You can work as a research head, even if like, if you, with your license, you can teach. So there are like tons of opportunities that you have,
Mhm.
if you don't want to just go forward with the clinical side of it. Yeah. So one of the things that actually encouraged me to go forward with my process was the work and the respect that they get,
Yeah.
and the social, the social status that you get once you become an RPH.
Oh.
Yeah, it's really great. It's all worth it at the end. The whole field of pharmacy is always booming. It's all like, when I started, because they increase the scope of the pharmacist, I think pretty much every year. When I started, the pharmacists were, so here, the
Mhm.
pharmacists are licensed to give you injections.
Okay.
like from India. So you can actually you can actually immunize people. Last year, what they did was, so where I am staying, all the pharmacists can now, if they take like something called APA, they can now prescribe for minor ailments, which is like
So
awesome.
cool.
You can basically prescribe for
Wow.
all the minor ailments, UTI, anything that doesn't need a blood work,
Hmm.
skin, any infection, they can do it. Birth control, like the
Wow.
amount of work, yeah, they can prescribe everything. So I think they did it because they have to just ease the pressure on the doctors and make them more available to attend to other serious cases.
Hmm.
So anything they can do, strep testing, they
Hmm.
do travel consultation, travel vaccines.
Oh,
So yeah, the scope increases every year.
oh, this is exciting. This is
Yeah,
exciting. This is exactly
yeah,
what
it was
you
very
wanted to do,
exciting.
Pharm D, right?
Yeah, like we'll be very stressed. Oh, how can I prescribe? I don't think I'm like comfortable to prescribe, but you have all the tools. You don't have to worry about it.
Yeah,
You
yeah.
have all the tools that you can use. And they started it with UTI, and now they just increased it to all minor ailments.
Wow.
Anything, they can do it. But anything that doesn't, they can order for blood work. So in Canada, only doctors were supposed to order a blood work for a patient.
Hmm.
But now, if the pharmacist have APA, if they feel like, oh, this guy needs to get a blood work done,
Yeah.
they can actually order for it. So
So,
it's great. So it's gonna increase anyways. So
mhm.
as time goes by, your scope is gonna go big and wide.
So what advice would you give for pharmacy students who are planning to move to Canada? When should they start preparing for this whole exams registration process?
They can start preparing right away. They don't have to wait for anything, because you actually only need to come to Canada for the last step of exam. So even if you're not in Canada, you can still go through the entire process
Mhm.
because everything is online.
Okay.
So you can do the evaluating exam from home. So you can do the document evaluation from home. You
Okay.
can do MCQ from home. So for the OSCE, you'll have to come to Canada because it's actually done in person.
Okay.
So that is the final step. So you basically can do everything from your home. And even in term, like if you're taking a course, so in my case, I did a course. I would suggest the same to all the people who are watching this video, because when I started, I went through the syllabus for the exam and it's very vast. And I did Pharm D. So the syllabus basically included everything that I had from my first year to sixth year.
Okay.
It's very vast. It's very overwhelming. So I didn't know where to start and where to finish. I didn't know what to study, and it was too much. So there are a lot of courses that's available in Canada who help you with preparing for this exam. So I
Okay.
did something called Pharmacy.
Mm-hmm.
Yeah, like one of the popular ones here. But if you find another one, then there are a lot of courses available. So PharmaChief, basically what they do is you have to enroll for a course,
Mm-hmm.
and they will provide you with the materials. They will provide you with video lectures. They'll give you mock exams, sample questions, even quizzes.
Mm-hmm. Mm-hmm.
And you don't have to, in my case, I didn't use any other references. I just went by their notes. That's it.
Cool. Okay. Yeah, yeah.
Because they have a lot of experience, and they know what topic is important and what's not. So the whole note was concised, and yeah, it was really helpful. So I would suggest taking a course rather than preparing all by yourself,
Mhm.
because it can be too much.
Okay.
There are tons of other institutes available. Pharmacy, there is MISBA, there is Pharmacy Scope, there is Pharmacy Prep, there is tons of them available.
Mhm.
But I just did Pharmacy for all my exams, and I found them really helpful.
Yeah, yeah.
So if you find anything better than Pharmacy, then great, go with it.
Yeah, yeah.
Rather than, yeah, I would suggest always doing something like that rather than just studying all by yourself,
Makes sense. Yeah.
because it's like too much.
So is it available in all provinces of Canada, or is it?
It is. So they basically have their classes all like video recordings. It's all online. So you get access to the notes. So I think once you get enrolled to the course, you can download the notes and keep it with you. But you're not supposed to share it to anyone because it has copyright issues, something like that. But the video lectures and the quizzes are really, really important.
I see. Okay.
Those are only available until the course expires.
Mm.
So yeah, you have to be tricky. You have to do the math. Just fix your mind when you're writing the exam, and then think about the course.
Yeah. So if you guys liked watching my video and you want me to cover a specific country that you have in mind, please do let me know in the comment box below. I'm going to be covering those countries in future. Until then, take care. Ciao.